In this chapter we will discuss the foundation of psychiatric mental health nursing. After reading this chapter, you should be able to 1. Describe characteristics of mental health and mental illness. 2. Discuss the purpose and use of the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, using the 4th edition, text revision of DSM-4-TR. 3. Identify important historical landmarks in psychiatric care. 4. Discuss current trends in the treatment of people with mental illness. 5. Discuss the American Nurses Association standards of practice for psychiatric mental health nursing. 6. Describe common student concerns about psychiatric nursing. As you begin the study of psychiatric mental health nursing, you may be excited, uncertain, and even a little anxious. The field of mental health often seems a little unfamiliar or mysterious, making it hard to imagine what the experience will be like or what nurses do in this area. This chapter addresses these concerns and others by providing an overview of the history of mental illness, advances in treatment, current issues in mental health, and the role of the psychiatric nurse. Mental health and mental illness are difficult to define precisely. People who can carry out their roles in society and whose behavior is appropriate and adaptive are viewed as healthy. Conversely, those who fail to fulfill roles and carry out responsibilities or whose behavior is inappropriate are viewed as ill. The culture of any society strongly influences its values and beliefs, and this in turn affects how that society defines health and illness. What one society may view as acceptable and appropriate, another society may see as maladaptive and inappropriate. The World Health Organization defines health as a state of complete physical, mental, and social wellness, not merely the absence of disease or infirmity. This definition emphasizes health as a positive state of well-being. People in a state of emotional, physical, and social well-being fulfill life responsibilities, function effectively in daily life, and are satisfied with their interpersonal relationships and themselves. There is no single universal definition of mental health exists. Generally, a person's behavior can provide clues to his or her mental health. Because each person can have a different view or interpretation of behavior, depending on his or her values and beliefs, the determination of mental health may be difficult. In most cases, mental health is a state of emotional, psychological, and social wellness evidenced by satisfying interpersonal relationships, effective behavior and coping, positive self-concept, and emotional stability. Mental health is a balance in a person's internal life and adaptation to reality. It is a state of well-being in which a person is able to realize his potentials. Characteristics of a healthy person includes attitude of self-acceptance, growth, development, and self-actualization, integrative capacity, autonomous behavior, perception of reality, environmental mastery. Mental health has many components, and a wide variety of factors influence it. These factors interact, thus, a person's mental health is a dynamic, or ever-changing, state. Factors influencing a person's mental health can be categorized as individual, interpersonal, and social/cultural. Individual, or personal, factors include a person's biologic makeup, autonomy and independence, self-esteem, capacity for growth, vitality, ability to find meaning in life, emotional resilience or hardiness, sense of belonging, reality orientation, and coping or stress management abilities. Interpersonal, or relationship, factors include effective communication, ability to help others, intimacy, and a balance of separateness and connectedness. Social/cultural, or environmental, factors include a sense of community, access to adequate resources, intolerance of violence, support of diversity among people, mastery of the environment, and a positive, yet realistic, view of one's world. Mental illness. The American Psychiatric Association, APA, 2000, defines a mental disorder as a clinically significant behavioral or psychological syndrome or pattern that occurs in an individual and is associated with present distress, example a painful symptom, or disability, i.e., impairment in one or more important areas of functioning, or with a significantly increased risk of suffering death, pain, disability, or an important loss of freedom. General criteria to diagnose mental disorders include dissatisfaction with one's characteristics, abilities, and accomplishments. Ineffective or unsatisfying relationships. Dissatisfaction with one's place in the world. Ineffective coping with life events. And lack of personal growth. In addition, the person's behavior must not be culturally expected or sanctioned. However, deviant behavior does not necessarily indicate a mental disorder. APA, 2000. Factors contributing to mental illness can also be viewed within individual, interpersonal, and social